The lack of mental health services means that police are often the first to respond to crisis calls.
And it's estimated that mental health accounts for at least 20% of calls for service. According to the Washington Post research, since 2015, nearly a quarter of people killed by police in America have a known mental illness.
Our Lindsay Nadrich shows you a program in Clackamas County that's working to change how mental health calls are handled.
Amid calls to defund police, law enforcement say they know they're not the best response for every call, especially when someone is in a mental health crisis. The Clackamas County Sheriff's Office says a lot of the calls they respond to do have a mental health component, so they decided to take a different approach to help someone in crisis.
Police and fire dispatch.
911 is the number many of us know to call. But who do you call if you see someone in a mental health crisis?
You know, we work primarily on street corners, buildings, homes. We'll go to a lot of people's homes, and just getting out to where people are so that we can help resolve the crisis as best possible.
Both Multnomah and Clackamas counties have 24-hour crisis phone lines, staffed with teams of behavioral health clinicians trained to meet with people. But a lot of the calls that should go to the crisis line still end up with law enforcement.
You know, a deputy could find that person, show up, take them to jail for a criminal mischief. But is that really the best solution?
Knowing it's not always the best solution, the Clackamas County Sheriff's Office partnered with the Clackamas Behavioral Health Division to bring 2 mental health clinicians into the Sheriff's Office full-time. Stephen O'Sullivan is one of them.
If police are getting a call and family want the police there, or they're kind of hesitant about having police, police can quickly access us.
Stephen and another clinician work with the Sheriff's Office 7 days a week and go out on calls with deputies when someone is having a mental health crisis. They're also able to connect people with services like housing and treatment and follow up with the person after the fact.
Law enforcement has a limited set of tools that they can use, and we have all the community resources, and so the mission of our team is to prevent unnecessary incarcerations and hospitalizations and to help people stabilize in their communities and use their supports and build support around them when they need it.
Program Supervisor Stacy England says the partnership has made a huge difference in how these types of calls are handled.
For the most part, when we arrive on scene, you know, the officers are inviting us onto their scene, and they're very relieved when we arrive because they know that we'll step in and try and help de-escalate that situation, and they can go back to managing the safety.
They're really able to connect with people that have mental health issues and offer them a level of service that we couldn't do ourselves as deputies.
This partnership started more than a decade ago, but Sergeant Marcus Mendoza says the need for it has only grown.
The call load isn't getting any lower, so we could, always use more help.
On average, the clinicians are called to assist deputies 2 to 4 times a day in person and roughly 5 times a day by phone, in addition to following up with people in crisis after the initial contact.
You know, the officers call us a lot because they're concerned about the person and they just feel uncomfortable leaving because here we have a person who may be houseless, is in a mental health emergency, and they don't want to leave that person on the street. They want to see that person get better.
Both deputies and clinicians tell me this partnership has led to better outcomes for people in crisis, especially in cases where someone doesn't trust police.
And a lot of times the family members will voice their fears and their concerns about what could have happened versus kind of how things turned out, which is nice.
We're coming in with just a very different perspective and a background in mental health.
And that different perspective is in high demand. Mental Health America ranks Oregon near the bottom when it comes to access to mental health care. Programs like this aim to change that.
The need for our services is very high, and we're actually hoping to continue to be able to expand our team. We keep very busy, and I think that, we can keep getting busier.
Clinicians are available to assist deputies 24 hours a day, but the team embedded with the Sheriff's Office only works until 7 p.m. After that, deputies have to call the crisis line, so they're talking about adding an overnight team as well. The 2 clinicians with the Sheriff's Office are also called on occasion to assist Oregon State Police, the Canby, Milwaukee, and Sandy Police Departments. I'm Lindsay Nadrich, reporting 6 News.